without proper protective gear, which puts their lives at risk. The health workers want the government to procure and distribute adequate personal protective equipment, as well as conduct rigorous training for all health workers countrywide to improve on preparedness, detection and timely response. NTV's Sharon Baranga has more.
We are really staying in fear, especially now that we have been left out. It's like we have been left out.
Cassandra, not her real name, is a public health worker. Owing to the nature of her job, she is in the front line in battling COVID-19. But like her colleagues, she fears for her life. She says they do not have the appropriate protective gear to handle suspected coronavirus cases.
It is the nurse or the clinical officer, a medic, who should take this patient to the isolation ward. This nurse has no protection. You don't have the mask, you don't have those clothing. How do you go in to take that client or the patient to the isolation ward and you don't have any protective attire? And remember, this is already a suspect.
Protective gears that we need, the masks, the gowns, we are yet to get any information whether the county government or the national government is giving consideration to assist the private health facilities or the faith-based health facilities.
The Association of Public Health Officers wants the government to procure and distribute adequate personal protective equipment, as well as to conduct rigorous training for all health workers countrywide to improve on preparedness, detection and timely response on any suspected case of coronavirus.
It is important that we protect our people while they are doing the good work that they are discharging the services. We are appealing that those people who are making the hand sanitizers not to escalate the prices.
The public health officers are the link people between the community and the referral system. Train public health officers.
They are also proposing a lockdown on public entertainment spaces, which they say pose a danger of further spread of the virus.
I'm also supporting the idea of closure of markets and social gatherings. And I'm also appealing to all public health officers and the technicians in this country, because they are empowered by law to enforce all what our leaders are talking about.
The Association of Public Health Workers says that the few numbers of employed public health officers is compromising the country's fight against COVID-19. They want the over 350 public health officers who have trained and are registered employed so as to alleviate the shortage at the point of entry and in the counties.
Since devolution, the national government and the county government have not really recruited this cadre of health workers who are mandated to prevent and control both infectious and non-infectious diseases.
Meanwhile, Migori County Governor Okoth Obado has assured public health officers in his county that they will soon receive the protective gear.
As part of our emergency response, we are in the process of acquiring more and more of those protective clothing to supply to our health workers and the team that will be handling all these things.
The public health officers also want the government to put in place adequate quarantine facilities in all the counties. Sharon Baranga, NTV.